CLL is the most common leukemia in the Western world, in fact, and it accounts for about 30% of adults with leukemia. And it's only seen in adults. It's not a childhood disease. The etiology is really not very clear. One of the etiologies that we do know of is exposure to Agent Orange, but obviously that's a minority of patients who develop CLL. So for the most part, we are not clear on what causes CLL to develop. CLL is a little bit of an unusual leukemia in the sense that you don't actually have to do a bone marrow to make the diagnosis. And that's because we can take advantage of flow cytometry by sending a peripheral blood sample for flow cytometry and getting that classic phenotype that we get for CLL, namely the presence of B-cell markers, since it is a B-cell disease, but the simultaneous presence of CD5, which we normally think of as a T-cell marker. If we want to determine mutation status on patients, again, that can be done also from the peripheral blood. We do need to send a sample to a lab for sequencing of the IGHV gene. An important prognostic factor in CLL is determined by the FISH panel that we use, and that typically detects 4 common abnormalities in CLL: trisomy 12, 13q-, 11q-, and 17p- or deletion. There is some value to doing standard cytogenetics because data has emerged that another prognostic factor is complex karyotype. So if the patients have a complex karyotype, that confers a very poor prognosis. And that can be done from the blood with decent yield. Sometimes you do get a better yield from the bone marrow, but since otherwise we don't generally need a bone marrow, we can send cytogenetics from the peripheral blood and a standard FISH panel. There is only one association between mutation status and a specific chromosomal abnormality. In other words, patients, even with the worst prognosis chromosome abnormality of 17p deletion, can have a mutated or unmutated IGHV gene. The one where there's a very tight correlation is 11q-. So 11q deleted patients, about 90% of the time, are unmutated. And that confers a poor prognosis, the fact that they're unmutated, but in addition, the fact that they're 11q deleted confers even more of a poor prognosis in general with chemotherapy, although that may be changing with some of the newer targeted therapies.